How do I test for DKA? If you are wondering how to test for diabetic ketoacidosis or DKA, you are not alone. Understanding this condition is vital, especially for those managing diabetes. DKA can be life-threatening, so knowing how to identify it is essential. DKA occurs when your body produces high levels of blood acids called ketones. This usually happens due to a severe lack of insulin. It is important to note that DKA is different from nutritional ketosis, which is a safe state achieved through a low-carbohydrate diet. In DKA, you will have both high ketones and high blood sugar levels, along with metabolic acidosis. If you suspect you may have DKA, especially if you have diabetes, seek medical help immediately. Common symptoms include excessive thirst, frequent urination, nausea, vomiting, abdominal pain, weakness, confusion, and a fruity odor on your breath. To test for DKA, healthcare providers typically use a combination of methods. First, a blood glucose test measures the amount of sugar in your blood. In cases of DKA, blood glucose levels are usually very high, often above 200 milligrams per deciliter. Next, ketone testing is essential. Ketones can be measured in urine or blood. Urine strips are often used first for convenience. If urine ketones are positive, a blood test for beta-hydroxybutyrate, the main ketone in DKA, is usually done for confirmation. Blood ketone meters provide more immediate and accurate results than urine strips. Another important test is the arterial or venous blood gas test. This checks the acidity of your blood. DKA causes your blood to become more acidic, so this test is crucial. A venous sample is often used for monitoring since it is less invasive than an arterial sample. Additionally, a basic metabolic panel is performed to check electrolytes, kidney function, and other markers. This helps assess the severity of DKA and guides treatment. Other tests may include a complete blood count and blood urea nitrogen. For those on a ketogenic diet, it is important to understand the difference between nutritional ketosis and DKA. Nutritional ketosis typically involves lower blood ketone levels, normal or low blood sugar, and no acidosis. If you are on a keto diet and feel unwell, do not assume it is just the keto flu. Check your blood sugar. If it is high, especially above 240 milligrams per deciliter, and you have symptoms of DKA, test for ketones using a blood ketone meter if possible. If you detect moderate or high ketones along with high blood sugar and feel sick, contact a healthcare provider immediately. Do not delay seeking help. If you have type 1 diabetes or are on insulin, be extra vigilant. Know the symptoms and have a plan for testing and treatment. Regular monitoring of your ketone levels can help you stay safe while enjoying the benefits of a ketogenic diet.